this all the time, especially around October, but mammograms help save lives, and it's Wellness Wednesday, and joining us here now from EVMS in partnership with Healthy Portsmouth is Amy Paulson. Amy, talk to me about what we have going on, because, you know, I feel like people focus on breast cancer during October and then it's kind of done with, but we have a big initiative happening in Portsmouth right now.
Absolutely. So first of all, Healthy Portsmouth is a coalition of partners that have come together from across the city to try to impact health in Portsmouth, where people live, learn, play, work, and worship. And so this issue came to our radar screen about 2 years ago, and we decided to start focusing on it, really mainly doing some awareness activities in October. And through additional conversations and looking at some of the data in Portsmouth, we realized that we had a much bigger problem than we had originally looked at.
Yeah.
Portsmouth is the #1 in the region for deaths from breast cancer, and that's particularly true for Black women. We're not the #1 city, though, for incidence, and what that means is that we have women who are getting diagnosed possibly later in their breast cancer journey, which means that the survivability is less for them.
So that's a lot to deal with in general and thinking about Portsmouth in this way, but you guys found a way that hopefully people can get help without going too far from their home.
Absolutely. So we have a group of partners that work together, Eastern Virginia Medical School, the City of Portsmouth, Portsmouth Health Department, Centera Health, Bon Secours, and Rewards for Healthy Living. And so we came together to try to find a solution. So we're working collaboratively with Centera Health because they've got a mobile unit, and they're bringing the mobile unit to the city every single month for the next year. And the coalition and its partners and a lot of students from many schools from across the whole region are coming together to provide the outreach to identify women who are in need of mammography services and to sign them up for whichever event is going to best meet their needs and is close to their home or their ability to access.
I feel like with a lot of people, when they hear, you know, you can go get tested, they automatically think, okay, what do I have to pay? My insurance is going to cover this. What's the answer for them when they start thinking like that?
Well, for most people, if they've got insurance, it would be rare for insurance not to cover it if they're at least 40. The Affordable Care Act has created a situation where women can get annual mammograms starting at age 40. If you're younger than that and you have particular risk factors, so a strong family history of breast cancer, for instance, or if you have any signs or symptoms, you can get it covered at an earlier age, and you would just need to talk with your physician about that. Now, if you don't have health insurance, that's often a big reason why people put it off. But we do have funds available for women to apply for that will not only cover the mammography for them, but will also, if they find anything, will cover the rest of the diagnostics and treatment for them. So there really is no reason, if you don't have health insurance, all you have to do is just reach out to us, reach out to Centera, and we'll get you connected with those resources and get them signed up for a screening mammogram.
And now Portsmouth has a unit that's going to be there once a month for the next year to help. Now, it's not going to be in one location, you said. This is going to be kind of traveling around the city. No,
and that's part of the partnership as well, is that we have host sites, churches, the YMCA, other partners from across the city that are hosting the unit. And so the unit will just drive up into their parking lot, and women, all they need to do is get an appointment. They drive up, they park, they go right in. There's a little waiting area for them, the little changing area. They register, they brought back in 15, 30 minutes. They're in and out of there.
So easy.
Yeah.
And for people that now want to say, okay, where can I go to learn more information? Where's the next step for them to go?
Sure, they could either email us at healthyportsmouth@gmail.com. That's a great way to reach the coalition and its partners, and one of us will respond to them. They can also reach out to Centera, and I'll make sure I get their number correct, which is 757-736-0040, and that's their scheduling line. And what they would need to do is just let them know, for instance, that they want to come to a particular event. So, for instance, our next one is going to be at New Mount Olivet Church in Portsmouth on the 20th of February. So they would just call that line and say, I want to sign up for mobile mammography on that date, and they can connect that way. We're posting a lot of this also on our Facebook page. So if they go to Facebook and look up Healthy Portsmouth, they can find all of the upcoming events there.
Perfect. Amy, thank you so much for joining us this afternoon. An awesome initiative.